Trigger finger, also known as stenosing tenosynovitis, is a common hand condition. It affects the tendons in your fingers, making it difficult to bend or straighten them. Imagine a rope and pulley system. The tendons in your fingers act like ropes, sliding through sheaths that act like pulleys. When these sheaths become inflamed, it's like the pulley getting jammed, making it hard for the rope to move smoothly. This condition often affects a single finger, typically the ring finger or thumb. In some cases, multiple fingers might be affected simultaneously. Trigger finger can be painful and interfere with everyday activities such as writing, cooking, or buttoning clothes. The good news is that trigger finger is treatable, and many people find relief with conservative measures. Understanding the causes, symptoms, and treatment options can empower you to seek timely medical advice and manage the condition effectively. Recognizing the early symptoms of trigger finger is crucial for early intervention and better treatment outcomes. The condition typically manifests gradually, with symptoms worsening over time. One of the most common signs is a clicking or popping sensation when you bend or straighten your finger. This is often accompanied by stiffness, especially in the morning. You might also notice tenderness or a small lump at the base of the affected finger, near the palm. As the condition progresses, the finger may become locked in a bent position. You might need to use your other hand to straighten it, often followed by a painful snapping sensation. In severe cases, the finger may become permanently locked. If you experience any of these symptoms, it's important to consult a healthcare professional for an accurate diagnosis and to discuss the most appropriate treatment options for your specific situation. The exact cause of trigger finger is not always clear, but several factors can contribute to its development. One of the primary culprits is inflammation. It leads to thickening of the tendon sheath, restricting the smooth gliding of the tendon. Repetitive hand movements, often seen in occupations like typing, knitting, or playing musical instruments, can irritate the tendons and increase the risk of developing trigger finger. Certain medical conditions like diabetes, rheumatoid arthritis, and hypothyroidism can also predispose individuals to this condition. Other risk factors include previous hand injuries, certain medications, and genetic predisposition. While anyone can develop trigger finger, it's more common in women and individuals over 40. Understanding the risk factors can help you take preventive measures like modifying activities that strain your hands, managing underlying medical conditions, and seeking prompt medical attention for any hand pain or discomfort. Diagnosing trigger finger typically involves a physical examination by a healthcare professional experienced in hand conditions. They will ask about your symptoms, medical history, and any activities that might be contributing to the problem. During the examination, the doctor will gently feel your hand and fingers, checking for tenderness, swelling, and any nodules or thickening in the tendon sheath. They will also assess the range of motion in your fingers, looking for any catching, locking, or difficulty bending or straightening them. While imaging tests like X-rays are not usually necessary to diagnose trigger finger, they might be recommended in some cases to rule out other conditions or assess the severity of the condition. Based on the findings of the physical examination and your medical history, the doctor will make a diagnosis and recommend the most appropriate treatment plan tailored to your individual needs and goals. Section 5. Non-surgical treatment options. The good news is that trigger finger can often be effectively managed with non-surgical treatment options, especially when diagnosed early. These conservative measures aim to reduce inflammation, improve tendon mobility, and alleviate pain. Resting the affected finger is crucial, especially avoiding activities that exacerbate the symptoms. Your doctor might recommend wearing a splint to keep the finger immobilized in a straight position, allowing the inflamed tendon sheath to rest and heal. Gentle stretching and range of motion exercises can also help improve flexibility and prevent stiffness. Over-the-counter pain relievers like ibuprofen or naproxen can provide relief from pain and inflammation. If these measures prove insufficient, your doctor might recommend corticosteroid injections. These injections deliver medication directly into the tendon sheath, effectively reducing inflammation and allowing the tendon to glide more smoothly. Section 6. When is surgery necessary? While non-surgical treatments are effective for many people with trigger finger, surgery might be necessary in some cases. If conservative measures fail to provide adequate relief after several months, or if the finger is locked in a bent position, surgery becomes a viable option. Surgery for trigger finger is generally safe and effective with a high success rate. It involves a relatively straightforward procedure performed under local anesthesia, allowing you to return home the same day. The decision to proceed with surgery is made on a case-by-case basis, considering factors like the severity of your symptoms, the impact on your daily activities, your overall health, and your preferences. Your doctor will discuss the risks and benefits of surgery, answer any questions you may have, and help you make an informed decision that aligns with your individual circumstances. Section 7. Surgical treatment options. If surgery is deemed necessary, there are two main surgical options for treating trigger finger open surgery and minimally invasive surgery. Each of these methods has its own set of benefits and considerations, which your healthcare provider will discuss with you in detail. Both procedures aim to release the constricted A1 pulley, allowing the tendon to glide smoothly again. This is crucial for restoring normal hand function and alleviating the pain and discomfort associated with trigger finger. Open surgery involves making a small incision in the palm of your hand to access the affected tendon sheath. This traditional method provides direct visualization of the tendon and pulley, ensuring precise release. The surgeon then cuts the A1 pulley, releasing the constriction and restoring normal tendon movement. This method has been widely used and is known for its effectiveness. This procedure is typically performed on an outpatient basis under local anesthesia. Patients can usually go home the same day, making it a convenient option for many. Minimally invasive surgery, also known as percutaneous release, is performed through a much smaller incision using a needle-like instrument. This technique is less invasive and can be done more quickly. Guided by ultrasound, the surgeon inserts the instrument through the skin and releases the A1 pulley. The use of ultrasound ensures accuracy and minimizes the risk of complications. This technique offers faster recovery times and less scarring compared to open surgery. Patients often experience less post-operative pain and can return to their normal activities sooner. Your surgeon will discuss the most suitable surgical approach for your specific case, considering factors like the severity of your condition, your medical history, and your personal preferences. It's important to have a thorough discussion to make an informed decision about your treatment. Section 8. Life with trigger finger and the importance of early treatment. Living with trigger finger can be challenging, as it can significantly impact your ability to perform everyday tasks that require gripping, pinching, or making a fist. The condition, also known as stenosing tenosynovitis, occurs when the sheath surrounding the tendon in the affected finger becomes inflamed, making it difficult for the tendon to glide smoothly. Simple activities like buttoning your shirt, tying your shoelaces, or even typing on a keyboard can become frustratingly difficult. The pain and stiffness can make these routine tasks feel almost impossible. Holding a cup of coffee, for instance, can become a painful ordeal, as the fingers may lock or catch in a bent position, causing discomfort and inconvenience. Early diagnosis and treatment are crucial for preventing the condition from worsening and potentially leading to permanent stiffness or loss of function in the affected finger. Treatments can range from splinting and anti-inflammatory medications to more advanced options like corticosteroid injections or even surgery in severe cases. Seeking prompt medical attention at the first signs of trigger finger can significantly improve your chances of a full recovery and minimize the impact on your daily life. Early intervention can help manage symptoms effectively and prevent long-term damage. While trigger finger can be a frustrating condition, it's important to remember that it's often treatable, and many effective options are available to manage the symptoms and restore hand function. Physical therapy and specific hand exercises can also play a vital role in recovery. By working closely with your healthcare provider and following their recommendations, you can regain control of your hand health and continue enjoying your favorite activities. With the right treatment plan, many people find significant relief and can return to their normal routines without pain. Section 9. A positive outlook. While trigger finger can be a painful and bothersome condition, it's essential to maintain a positive outlook. Keeping a hopeful and optimistic attitude can significantly impact your overall well-being and recovery process. The good news is that with early diagnosis and appropriate treatment, the majority of people with trigger finger experience significant improvement or complete resolution of their symptoms. This means that many can return to their daily activities without the constant discomfort. By understanding the causes, symptoms, and treatment options, You can take an active role in managing your condition and work towards a positive outcome. Knowledge empowers you to make informed decisions about your health. Remember, you're not alone in this journey, and a team of healthcare professionals is available to guide you through every step of the way. They are there to provide support, answer your questions, and offer the best possible care. Whether it's conservative measures like rest, splinting, or medication, these initial steps can often provide significant relief and prevent the condition from worsening. Or surgical intervention in more severe cases, which can offer a more permanent solution when other treatments have not been effective. Effective treatments are available to address your specific needs and help you regain pain-free and functional use of your hand. Rehabilitation and follow-up care are crucial to ensure the best outcomes. With the right approach and a positive mindset, you can overcome the challenges of trigger finger and get back to enjoying the activities you love. Embrace the journey towards recovery with confidence and hope.
Thanks for watching. Please like, share, and subscribe. And remember to click the notification bell to know when future videos are released.